Hello guys, I am Dr. Parthasarthi Dutta. I am a consultant dermatologist, cosmetologist and a trichologist. I run a hospital called Dr. Parthasarthi's Hair and Skin Hospitals in Bangalore. Today we will be talking about questions what usually people ask before a hair transplant. First of all, you should know what is FUT and FUE and combination of FUE and FUT. So according to your donor area and according to your recipient area, we decide whether to do FUT or FUE. Now, most of the people actually insist for FUE, since in this there will be no skin taking from the scalp and bleeding will be less, pain will be less, and it is a more, you can say, more modern method. But there are disadvantages also, like FUE. Once you do, there will be permanent scars back of your scalp. The tiny scars will be there. For that reason, we cannot, from that particular area, you will not get hair follicle if you want to do again in future. But in FUE, that is not the case. In follicular unit extraction, if you do this also, after doing FUT, again we can go for FUE or FUE-FUT combination, because here we'll take a strip and then the area, the scalp will be sutured at that area. The disadvantage is if you shave your hair, you will see a line on the back of your scalp. Another question arises, am I a good candidate for hair transplant? See, one thing you have to understand, that hair treatment we do also with mesotherapies, stem cell therapies, PRP treatment, and with medications other than hair transplant. So first we have to see whether the person is having hair on the scalp, the area where he wants to do, whether he is having minimum hair. If there is no hair at all, directly you should go for hair transplant only. Whereas if there are hair but it is thin, we can try other methods including PRP. Now there are 5 grades in hair balding. In that, in grade 5 or grade 4, definitely we have to do transplant only, and grade 2 and 3 we have to see maybe combination of medication, PRP and hair transplant. Next question is whether patient will feel pain while doing the surgery. See, the thing is, we'll give local anesthesia. While giving local anesthesia, we'll inject it, and that time you will get little pain, and once the anesthesia is completed, you will not get pain till we finish your procedure. Another question is hair transplant surgery long? How much time it is required? See, these are all depends on the case. Baldness is, if grade 5 baldness, definitely it will take more time, and grade 2 or 3 baldness, it will take lesser time. Whereas the time also depends on whether you are doing FUE or FUT. In FUT, it will be faster comparatively, whereas in FUE, it will be comparatively more time will be required. So usually we start hair transplant in the morning, for example about 10 or 10:30. If we start by 7:30 it gets over usually, but it depends. If sometimes if a bigger bald area is there, we divide it also. I mean, 2 sessions we do, 1 session now, 1 session after 6 months. Maybe frontal area will be doing now, and middle area will do in the next session. So it is always very subjective, but more or less 7 to 8 hours should be enough for a hair transplant. Another question is, will it look natural? Yes, it will look natural, but depending on few things, like one is your hairline, how doctor gives you the hairline, depending on that the natural look comes. Also recipient area, means where you will be going to, where you are going to put the follicles are bigger, donor area is comparatively have less hair, then maybe we cannot give that much density what people can expect. But usually if we do in 2 sessions, it is always better. So in that case, natural look will always come. Another question is cost of hair transplant. See, cost of hair transplant again varies. One is depending on your recipient area. The area where we have to put more hair, definitely it will be more expensive. Secondly, type of hair transplant, whether you are going to do FUE or FUT. FUT means it will be comparatively cheaper, whereas in FUE it will be comparatively costlier. Usually we per graft around 35 rupees to 60 rupees usually it is done. Sometimes we do as a package also, because the graft wise, suppose you need 3000 grafts and 3000 grafts may not be available in the back of your hair. Go for a package where we'll not count the grafts, we'll just cover all the portion of the recipient area, because in that whatever part is available, in that a lump sum amount of like between 50 to 70 to 80,000 up to 1 lakh it goes.